Social marketing. Social marketing can be defined as the design, implementation, and control of programs aimed at increasing the acceptability of a social idea, practice, or product in one or more groups of target adopters. Social marketing uses behavioral theory to influence behavior that affects health by assessing the factors that underlie the receptivity of audiences to messages, such as the credibility and likability of the argument. The 4 Ps of marketing are used to create strategic messages that aim to change the behavior. Social marketing planning requires us to understand and incorporate the 4 Ps of marketing into our program planning. Social marketing is critical because it looks at the 4 Ps in the provision of health services from the viewpoint of the consumer. The 4 Ps of marketing are product. It represents the desired behavior you are asking your audience to do and the associated benefits, tangible objects, and/or services that support behavior change. Price. This is the cost, financial, emotional, psychological, or time-related, of overcoming the barriers the audience faces in making the desired behavior change. Place. This is where the audience will perform the desired behavior, where they will access the program, products, and services, or where they are thinking about your issue. And finally, promotion. This stands for communication messages, materials, channels, and activities that will effectively reach your audience. There are 6 basic elements or stages of social marketing. The 6 basic stages are planning strategy, selecting channels and materials, developing materials and pre-testing, implementation, assessing effectiveness, and gathering feedback to refine the program. The last stage feeds back into the first to create a continuous loop of planning, implementation, and improvement. Social marketing is widely used to influence health behavior. Generally, a person in social marketing or health communications will create and use products, programs, or interventions to promote health changes in individuals and communities using strategies and tactics based on science and consumer research. Social marketers use a wide range of health communication strategies based on mass media, along with marketing methods such as message placement, promotion, dissemination, and community level outreach. Social marketers develop brands on the basis of health behavior and lifestyles, as commercial marketers would with products. For example, targeted and tailored message strategies have been used in anti-smoking campaigns to build brand equity. Brands underlying the Verb campaign and Truth campaigns were based on alternative healthy behaviors, marketed using socially appealing images that portrayed healthy lifestyles as preferable to junk food or fast food and cigarettes. Social marketing uses commercial marketing strategies such as audience segmentation and branding to change health behavior. One of the key decisions in social marketing that guides the planning of most health communications is whether to deliver messages to a general audience or whether to segment into target audiences. Audience segmentation is usually based on socio-demographic, cultural, and behavioral characteristics that may be associated with the intended behavior change. For example, the National Cancer Institute's 5 a Day for Better Health campaign developed specific messages aimed at Hispanic people because national data indicate that they eat less amounts of fruits and vegetables and may have cultural reasons that discourage them from eating locally available produce. Tailored communications are a more specific, individualized form of segmentation. Tailoring can generate highly customized messages on a large scale. Over the past 10 to 15 years, tailored health communications have been used widely for public health issues. Such communications have been defined as any combination of information and behavior change strategies intended to reach one specific person based on characteristics that are unique to that person, related to the outcome of interest, and derived from an individual assessment. Because tailored materials consider specific cognitive and behavioral patterns as well as individual demographic characteristics, they are more precise than targeted materials, but are more limited in population reach and may be more expensive to develop and implement. Social marketing uses behavioral, persuasion, and exposure theories to target changes in health risk behavior. Social cognitive theory based on response consequences, observational learning, and behavioral modeling is widely used. Persuasion theory indicates that people must engage in message elaboration for long-term persuasion to occur. Exposure theorists study how the intensity of and length of exposure to a message affects behavior. Social marketers use theory to identify behavioral determinants that can be modified. For example, social marketing aimed at obesity might use behavioral theory to identify connections between behavioral determinants of poor nutrition, such as eating habits within the family, availability of food with high calorie and low nutrient density in the community, and the glamorization of fast food in advertising. Social marketing aimed at changing health behavior encounters external and internal competition. Countless unhealthy eating messages, along with seductive lifestyle images associated with cigarette branding, can be seen through several communication channels. The following are examples of the use of social marketing to target behavior change.